and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗥𝗲𝗵 as we discuss the latest health and medical topics with doctors from 𝗥𝗲𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗥𝗲𝗵 on 𝗛𝗲𝗃 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗥𝗲𝗵, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search 𝗛𝗲𝗃 Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗥𝗲𝗵 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗥𝗲𝗵. I'm your host for the show, Nicole Jacinto. It's the first show of the year 2025. It's January 6th today here in the Philippines. And, well, it's the Feast of the Three Kings, so happy Three Kings in the name of the... Okay, no, actually, it's a religious feast celebrated by some Christian denominations like the Catholics. But anyway, I'm just greeting you all out there. It's been, of course, we just are getting over discussing this. It's actually a very apt topic to discuss because in a few days there is going to be one such event. But before we get to that event, you'll see, so just stay tuned and keep watching and keep listening to the doctor. You'll see why also for those of us here in the Philippines or in the Metro Manila especially and in the city of Manila, why this show is very important, and anyone actually can pick up anything from it, because at one point or another we are in a crowded place. You know, we do experience being in crowded places, and there are many tips, insights, and information that we can pick up and hopefully remember and are able to use if we find ourselves in any such kind of emergency or event. So welcome to the show, Doctor. How are you?
Hello, good evening, Miss Nicole. Happy New Year and happy Three Kings to you as well. And good evening to all the televiewers and listeners of our program.
Yes.
Good evening.
Thank you.
I'm good.
Okay, so doctor, we're going to talk about medical emergencies in crowded events. And I'd like to ask you, what are the common medical emergencies in events like concerts, festivals, and religious events? But maybe we can do the concerts and festival first,
Yes.
before we talk more about religious events, because it's really going to slide into an event that's coming up in a few days. And please feel free to give us like emergencies that you've seen yourself or have heard of or have experienced, or anything that's theoretical and both, like that you've seen in your practice as an emergency medicine specialist.
Okay. Yeah. Thank you very much for that question. What's particular about emergencies on crowded places, especially during concerts, events, festivals, is that we are in an area that is very crowded.
Mm-hmm.
And then when there is crowding, there's limited air flowing to the environment. So even though the environment is cool enough, there will be a sort of increase in heat because of decreased heat dissipation. So basically, most of the common emergencies that we see in this kind of events would be those of heat-related illnesses, such as heat exhaustion, heat fatigue, heat syncope or fainting, up to the worst case scenario, which is heat stroke. And then there could also be some dehydration, some, of course, injuries, because of in a crowded place, you cannot you cannot prevent being pushed or being hit by someone. So there can be injuries, such as wounds, contusions, and then also if someone has a panic disorder, so there can be a panic attack. And then the worst case that can happen, if you're so dehydrated, someone can go in a respiratory arrest or can die. So that's the worst case.
Okay, so from the milder case scenarios to the worst case scenario. That's a great answer, Doctor. You covered it all. And can I ask you now? I was just wondering if two things. If let's say it's a concert and or a festival, is there a difference in the s- in the emergencies you see in indoor versus outdoor
Uh,
events?
for emergencies and an outdoor door compared to an indoor. So in an indoor, there is some form of ventilation or air conditioning. While in an outdoor setting, you don't know what will happen. It can be as humid as it can be, or it can be cold, or it can rain.
Mhm.
So our preparation is very much different when we are preparing for indoor and an outdoor event. But
Yeah.
still, the same type of emergency and the same medications and some of the same treatment that we usually do, we prepare for that one.
Okay. And the second thing I was wondering, Doctor, is just to clarify a little bit more for the audience and for myself. When we talk about a crowd, because some people will say, "Oh, there's only 30 people there or something," or it's a barangay thing and there's only like 50 people or 100, and that's not much of a crowd. But we're talking about the limited space, right, Doctor?
Yes, yes.
Yeah. So I mean, you.
So So you're right. Actually, when we talk about crowding, it's a factor of number of people to the space. So you can have 1,000 participants, but you're in the area that which can accommodate 3,000. So that's not too crowded. You can be about 30 to 50 persons in an area that you can only accommodate 20 persons. That is already crowded. So it really depends on the number of people versus the space available.
Thank you, Doctor. Okay, so, well, we've talked about, by the way, with concerts or festivals, aside from the common emergencies that you mentioned, do we've heard of a lot of things in the past. Have you seen any like drug related or alcohol related emergencies also?
Yeah, yes. Unfortunate enough, about 2016, I guess, one of the festivals, concert events in Pasay City, I was one who attended to about four patients who succumbed to heat stroke
Wow.
because of that event.
Yeah.
So
Oh,
I had a very good experience, and I really know how it feels
how to
to have
handle.
those. Yeah.
Yeah. Yeah. Okay. Thank you, Doctor. Okay. So, all right. Let's talk about religious gatherings. And there's many ways to talk about a religious gathering. I mean, there can be a few of you praying, religious gatherings in nature, and then so there can be masses or what do you call that? A masses for Catholics, and for others, like I think they call it service or whatever, service or whatever it is that you whatever religion it is, no. And then sometimes it does get crowded in the church itself or the place of worship itself. And what we'd like to focus on though for today is also the translation. That is an outdoor event. I don't.
Yes.
Maybe you can talk a little bit about any indoor, religious gathering events that you've witnessed where there is an emergency. But the translation is an outdoor and indoor event.
Yes.
Okay. So just for those of us, I also had to ask and think, what is the translation? Then I'm like, oh, okay, it's the Feast of the Black Nazarene. So here in the Philippines, we call it the Black Nazarene. It's a dark statue of Jesus carrying the cross, that was brought around the 1600s. I think I didn't really, look it up, but um, I have covered that as a broadcaster, just the news because it's every January 9, and
Yes.
they close down the city of Manila because they have no choice. I,
Yes.
so basically, it reaches up to millions of devotees who go, and the statue is brought from. There's a reenactment. It's brought from Quirino Grandstand to the Quiapo Church. I think,
Yes.
yeah, if I'm correct. Sorry, okay. So the Quiapo Church, and so this topic is very apt for talking about crowds and religious gatherings. And I'm sure, although we may not, some of us may not have, gone to it or witnessed it, somewhere there, definitely as Filipinos in our culture, we've heard of it. So, when it comes to the translation, doctor, or well, if have you witnessed any other events aside from that, like smaller religious events, or just in your experience, or heard of any other things?
Yeah. Okay. Before that question, I'm wearing the color of translation just for this one. No, yeah, but answering your question, I have I mean, fortunate enough to experience being the one of the doctors or one of the ED teams or emergency teams during the Pope Francis visit in Manila. So that is a closer event in Mall of Asia, and yeah, so that is also a very big crowd. What is different from an indoor or a religious event is the type of the religious event. During the visit of Pope Francis, this is a very solemn meeting or a convention wherein all the people are in their best behavior, kumbaga. Yeah. As compared to different types of festival or religious events like the Transition, we have here in the Transition, what is particular is the procession, wherein the participants or the devotees are really trying to go near to the statue, to touch the statue and to push the statue or move the statue. So in this event, there is a sort of movement or a dangerous flow or movement that you have to control as compared to a religious event like the event in MOA, that people are following rules, following the lines, queuing, and then they're just stationed, seated or standing, just waiting for the message of the Pope. So very different.
Yes, that's true, doctor. I mean, and people are more on their best behavior, and they're there indoors, so it's well ventilated, and of course there's security for the Pope as well. And you're right, they're just waiting to hear the message of the Pope, and perhaps if they can, meet him or greet him, then they'll be so happy. But at the same time, they understand that it's solemn and they don't want to be hurting a person or other people.
Correct.
And they probably listen more. Whereas in an event like the Translation, as you said, there's a flow, no? Since the statue is being moved, people really do try to get to it and touch the statue, or somehow move it along with them so they can be part of the procession, I guess, or official carriers of the statue. And you've been at both events as an emergency medical, I mean, as a doctor. So okay, what have you seen there, in terms of, well, nothing untoward happened when the Pope visited. Was there any emergency?
Oh, because of the long because of the long waiting time, we have some patients who had episodes of dizziness, fainting as well, exhaustion, most common, dehydration, and then of course hunger, low blood sugar. And those for some hypertensive patients, hypertensive episodes such as headache and fatigue. As compared when I went to one of the transition, we just see a lot of emergencies, a lot of fainting episodes, panic attacks, dehydration, and trauma.
And trauma. Okay, so trauma meaning like injuries, because you get
injuries.
bumped.
Yeah. As you can remember in transition, some of them are not wearing slippers.
Yes.
They walk barefoot, so we have a lot of penetrating injuries because of barbecue sticks or other objects in the road.
Yes, it does. It does become a kind of really mixed up festival in a way, and sometimes people are there just to be there. No, not maybe. I mean, it's ironic because that it's supposed to, the Black Nazarene is associated with healing. No, most people or devotees want to touch the statue, or they're saying thank you for being healed.
Yes.
And then a lot of injuries do occur, and we hear about it every year. And as you said, so some people do go barefoot as part of their devotion, or it's part of what they do for the event, and they consider it a sacrifice, or just something that that they should be doing.
Yeah.
And as you said, barbecue sticks. So it becomes like people are eating, drinking all the way. Well, of course, because they might faint, and then there's people who are just kind of sightseeing there. Then there's
Yes.
yeah. So
Yeah, actually, even plastic bottles, when you step on it, sometimes it becomes sharp. You will have, and you step on it, so you can have injuries because of that one. So we
yes,
also have injuries because of that too.
there's a lot of trash also, literally on
Right.
the road. Okay,
Yes.
so doctor, okay, I don't want to ask you like sort of, no, I have to ask it. We don't have to answer it. Do you find that sometimes with this religious event, for example, so it's an outdoor thing, no, for the most part, um there are people who join in and they're not exactly solemn, and like they're kind of I don't know, maybe it's raised they're to such a hype that also their behavior, like they're not on their best behavior, so they're more likely to push or move about or do some destructive things.
Um, how do I say this? I don't
Okay, you don't
want
have to.
to. I
No,
don't
no,
want to sound
I understand.
degrading people, but as you can see, you have to analyze the event. In translation, in this event, the type of crowd would be really the CDE crowd
Okay.
compared to events like in the Pope visit, that most of the crowd is about, I mean, a mix of A to E.
Okay.
So when you have this type of crowd, of course, you will not know the way they uh, uh, act. Okay, some of
Okay.
them are well educated, some are really just doing it for the devotion,
Mhm.
tradition, and some of this is just transferred from their parents, father, and then they really don't know the essence of the procession. They
Mhm.
only know that they need to touch the Nazarene in order for them to
Mhm.
have the fulfillment, or to reach what they need or what they ask. Okay, so sometimes it's really on the knowledge on what to do. So sometimes most of them would pray, but most of them would just really try to follow the tradition of just moving the the statue of the Nazarene.
Okay, you don't have to answer this question. Have there been incidences? Because we don't, I understand you as a doctor, you don't want to judge people. Have there been incidences of drunken, disorderly people, like, mixing in with the actual devotees during, you
Uh,
don't have to answer.
Unfortunately, yeah, but to be honest, unfortunately, yes.
Okay.
Sometimes there will be some will be you can know, have a hint of alcohol, but very few. Unlike in other events such as a festival or
Yes.
concerts, yeah, it's very
That's like, I
yeah,
went, I've been to a bunch of festivals, but I have seen like two really drunk men just sort of like see each other, then they pulled out knives and they wanted to kill each other, but then they both fainted at the same time. It's like, well, that was lucky.
yeah,
I mean, for both
correct.
of them, that they didn't, strike each other.
Mm,
So yeah, those things do happen with the alcohol and all of that
mm,
emotions. But in this event, yeah, maybe some have mixed in, but
mm,
I guess you also have to be careful, even when you're a devotee and you're there for solemn reasons or your own reasons. So, doctor, when there is an event that's crowded like this, it's like millions of people in one day convening into this spot, or and moving along with the statue, or moving the statue along, and a medical emergency can happen anytime, like first outdoors, and then they bring the statue into the church, right? And then it continues wanting to.
yes.
I've heard some people say, I'll just wait in the church because it's too crowded outside, you know. So, how can bystanders or, you know, other just people or even like medical, like people who are stationed there and they're medical personnel or they have a bit of knowledge, how can they
Mm-mm.
tell us how we can recognize signs and symptoms like in people who are having medical emergencies already?
Okay. So for those who are in the know-how, I mean, for those who are in the field of medicine, it's very easy for us to identify these patients. But for common people, I mean, us, the
Yeah.
best way is to just look at the person. If the person is perspiring too much
Mm.
and it looks pale and then looks very, looks very tired, and you have those gestures of feeling dizzy or headache. So those are the things that you have to see, look for. So yung pinagpapawisan ng sobra, maputla ang labi, and then manghihina yung muka, parang tutumba. Yun ang symptoms. But for a patient, for someone who is attending the event, when you have a little bit of fatigue, you mean body weakness, nausea, you feel nauseous, you want to vomit, a little bit of headache and dizziness, then it looks like that you're starting to have fatigue, and you think you have to rehydrate or stop for a while, sit down, and observe yourself. So those are the things that you have to watch out. Symptoms, signs and symptoms.
And then, okay, so let's say there are people who, you notice it in yourself, di ba, napapansin mo, medyo nahihilo na ako, parang pagod ako, hindi ako sigurado sa nararamdaman ko, parang nanginginig ako. And if you're with someone, you tell them, or, you know, you notice that someone you've been near to in the crowd, even a stranger, is suddenly, as you said, perspiring too much, looking really unsettled, and, you know, they look like they need help. It's a sign of fatigue. First, fatigue. Assume it's fatigue because of the whole day on your feet or moving or the crowd, the heat. You have to stop first, or you might be dehydrated. But a lot of people will say, I don't want to drink and because I don't want to pee because there's nowhere to
Yes.
pee, right? So
Yeah.
does that also play into it? Like, have people just like, I guess I'm talking about some of the types of injuries or types of things that you see, um or types of experiences apart from, as you said, maybe you can go through the heat exhaustion and all
Yeah.
that just very quickly, but are
Yeah.
there okay, and they're
You're,
dehydrated?
you're you're very much correct. No, what's very particular in these events is that we advise them to drink fluids, plenty of fluids when you are in this kind of event. However, because of the limitations, as you mentioned, very difficult to go look for a bathroom in these kinds of event. Some of them will not really drink water, okay, intentionally. So that's why they get dehydrated. So, however, some of them would really drink a lot of water. Okay, so going to your question of what is heat exhaustion. So heat exhaustion is a part of a heat-related illnesses, wherein the patient feels the symptoms of starts with a feeling of very weak, fatigue, with nausea, vomiting, headache. This is most of the time secondary to dehydration. So because of the lack of fluid, lack of water, and then your body is trying to compensate when we are in the heat or in an environment that is very hot. Our body tries to compensate to to balance the heat. So what happens is we increase the heart rate. We perspire so that we can dissipate the heat, so we can cool down, and then we increase our breathing, and then because of that one, our blood vessels or also dilate, and then that's causing the flushing. So when we have our blood vessels dilate, all the blood goes down, and sometimes our blood pressure goes down. So this is the cause of the decrease in the blood going to your brain, causing decreased oxygen, causing the fainting episodes or the dizziness. So that are the sequence of events that happen when you are in a situation wherein it's very hot, you get dehydrated.
Yes, you did mention heat syncope earlier on in the beginning of the show, and that just it means fainting because of the heat, essentially, or your.
Yes,
All right, so that's all.
yes, correct.
Okay. And then have you? I'm now also thinking how the doctors and medical personnel pee and stay hydrated, but you don't have to answer that. Okay.
Actually, some to
Yeah.
be honest, you some of especially the female, especially when we're stationed not very near a latrine or a CR.
Mhm.
Sometimes we wear diaper
Yes.
during these events.
And I think maybe, that's a
Yeah,
good suggestion to the people who are not there to handle emergency situations. You can wear a diaper because there are no bathrooms around, and if you just like pull down
yeah,
your pants, and won't be a good thing.
yeah.
And
Eh, And we know the importance of getting hydrated. So we drink a lot of water. So we really hydrate during this time. So yeah, but that's why most of the time the stations of the doctors or the medical personnel are very near. I mean, we have those portalets. Yeah.
yes, yes. Yeah, the portalets. I remember a time when like it wasn't even that organized, so it would be really wow. I
Yeah.
never went to one in person because I didn't want to be in that situation, and I
Yes.
didn't don't know much about the Nazarene, that particular Nazarene. So um in when okay, if people need to sit down, so because they're already fainting, no, or they're having, and okay, what? But then if they sit down and there's nowhere to sit, what should you do, or what should the people accompanying them do? Because
Yes.
after you feel weak already, okay, you're fatigued, your feet are killing you.
Mm.
You didn't mean for it to happen. But if you sit down, is that worse because of the moving crowd? Or, I mean, can you give us some insight? Have you seen some injuries where, people just kind of sat down and then it was worse for them?
Yeah. So yeah, again, what's particular about these kinds of events is very difficult to manage an emergency. Number one, because of the limited space. So what we are telling people is when someone is in that situation, is for us to give space to that person. Okay. The important thing is for us not to crowd the person, but give a space to that person. Give that person an area that could have better ventilation and then better flow of air and so that we can manage the patient. So it's very important that when you are going to these kinds of events, you also have to choose where you will place yourself. Okay, so look for an area where we already look at the areas where you can see exits near portalets or near restaurants that you can go or an area where you can sit down and rest. So it's very important that you plan in this kinds of event. Is plan where you're gonna place yourself and look for the planned exits of the venue, so that you know where to go. So, but yeah, I've seen a lot of. I mean, I've been stationed to a lot of these events. It's very difficult, really, to manage a patient because number one, for us doctors or the medical personnel, it's very difficult even to go or respond to the emergency because sometimes you don't even know where they are when you have an emergency. So you really have to ask people when there is an emergency, someone is has an episode of loss of consciousness. Give the space and make sure you give put I mean a way wherein the medical professionals can move towards that patient. So give way.
Doctor, so that goes to like people who want to help the person in the crowd. So if they start noticing these symptoms and then somebody is already, fainting or collapsing or just needs to sit down and there's nowhere to sit, and sometimes people will say, I mean, well, I used to bring chairs sometimes to events, but still you're in the way. So,
Yes.
lower you kind of get, you want to stand up because I don't want to get smashed, you know. And I think it's very, very important that you reminded all of us to give someone who's having a medical emergency space, because a lot of people also, like, their tendency is to crowd the person, right? Are you okay? Are you okay? Or like,
Yes.
what's happening? Um and then the person has even less space, becomes more dangerous, and there's less air to breathe. And as you said, even the doctors themselves who are alerted to this, who are alerted to a situation wherein someone or some people are experiencing medical emergencies, have a hard time getting that to that patient. Do you have any tips for people in the crowd in terms of, like, how do they alert you
Yeah.
when it is, and alert you properly, and kind of like start preparing to help you get to this patient?
Okay. As I mentioned before, the important thing is actually know where the stations of the medical professionals are. So most of the time in this kind of events, there's already a crowd planning. So medical team are stationed every few meters. I mean, every 10 meters or so. So there are certain area that this team would respond. So know the location of the medical team. Try to be in that the place near the medical team. And then when you are in an emergency situation or you are responding to an emergency situation, you can actually shout your location to the medical team. Okay, it's either you shout the location, or as I've mentioned, it's like a relay.
Yes.
Sometimes you people will just relay where the location is, and you will actually know the direction of the victim by the people. Actually, they will lead you to the person.
That's great. I mean, when you see people cooperating like that, I mean, they can say, okay, by the trash can, by the trash can, by the trash can, by the trash can. Then, okay, 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 fainted, 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 fainted,
Mm,
fainted, fainted. So,
yes.
that helps a lot. And, uh, can I ask you, how many people, when you went to that event, how many people do you think, I mean, just an estimate of how many people experienced medical emergencies on that day?
Oh, an average of 15 to 20, depending on the number. One experience that I can mention is like during the political rallies.
Yes.
So yeah, during political rallies, although the host will mention emergency and then the location. In those events, you can see about. I had experience of 10 to 15 during a 4 hour event.
So it's even more, no?
Yeah.
Yeah. Yes. Yes, political rallies. Yes, I've been around those myself. And it happens really. You do get dehydrated, and
Yes.
people have emergencies. Sometimes you're running on adrenaline. You're out there trying
Yes.
to help, or you're being passionate about what you're expressing. Rallies or even campaigns and events. Even just even when we talk about festivals and concerts, but these things. Thank you also for answering my question earlier. Just want to remind people that it's a crowd if you don't have enough space. Okay, and doctor, okay, when when doctors attend events, do you also watch out for these signs in yourself? And do you end up sometimes having to treat each other?
Yeah, so yeah, definitely. When you're a doctor or you are assigned to these kinds of events, one thing that you have to make sure is you are healthy enough to respond. So because you cannot help someone if you will be the next victim.
Yes.
So it's very important when I ask my residents or my trainees for these kinds of events. So to participate is that I ask them to sleep well, rehydrate, eat, so that when you are doing your duties, you will not be the next victim. Okay. So, but of course, sometimes we have volunteers who have heart conditions, who have comorbidities. Sometimes they do experience a little bit of dizziness, body pains, weakness, and dehydration. So sometimes we treat ourselves during those events.
And as you said, doctor, no, it depends on the weather on that day. I mean,
Correct.
if you're outdoors and monitoring the flow of the crowd with the statue, is it raining? Is it too hot? I mean,
Yes.
right now, like today and the last couple of days for me, but I'm not in Manila City. The weather has been great. Like I
Yeah.
hope it's the whole year, but of course it's not. Um, and then I mean, for others, like I guess, like how do you prepare with the clothing? I mean, and maybe also for those who attend, should you wear certain types of clothing, certain types of colors, or what's the best thing to wear? Also, you're wearing. You said you're wearing the color of the translation. So
Yeah, the maroon, yeah, the color of the Nasrin, it's their color. Okay, so when you are going to attend, go for these crowded events, you have to wear light clothes, like cotton, so very light clothing. So don't. I mean, even though our weather right now would make us want to wear jackets, so please do not wear jackets. So anything that will protect you that is light and light colored, white, not dark, so that it will not absorb heat. Okay. What else? Dress appropriately, of course. Uh, short. I think shorts are not allowed during these events, and of course, wear footwear or protection for your feet during these events.
yes, doctor. I mean, of course, it's hot in this country, um, but as you said, since it's a religious event, dress appropriately, and also, um, some. I mean, it depends on the event, but also if you wear shorts to an event like this, you can probably get wounded also
Yeah.
more
Uh,
easily.
yeah, you have to protect. I mean, clothing is a way of protecting ourselves from injuries, such as wounds. So you have to protect. Wear pants for this one, and then if you can wear
You know
long
why it's
sleeves, that
dengue on the rise now, right?
yes. So most of the time they're wearing. The shirt that is long sleeves, the shirt that is very light cotton. Okay. Most of them at the time they're wearing white, but because of the color, they're wearing the this kind of color. Some of them. So wear very light clothing, and then of course you have to protect yourselves from the weather. If it rains, although I guess they are trying to uh, prevent you from bringing umbrellas because it's danger also for sharp objects. So you can bring some capote or raincoats or cap to
Or
protect you from the rain.
And then afterwards, if you do get rained on, you'll see a doctor because I have a cough. I have a cough.
Yes.
Okay,
Yeah.
doctor. Well, I'm sure a lot of people bring handkerchiefs or some cloth because they
Yeah.
like to wipe it on the statue, right? Like a
Yes.
sort of symbol and the significance of passing on the healing. So
Yes.
probably have two actually, one for the perspiration and whatever, and the other one for the statue. Um, and then also, doctor. So beyond these questions that are basic, but you've really given us a lot of information, and I thank you for that. And as you said, light clothing because it doesn't absorb heat as much as dark
Yes.
does, and wearing longer sleeves and pants. It's not just because it's a religious event and you're trying to dress appropriately, but it is protection for your skin and wounds. And then footwear, doctor, you mentioned earlier that some people go barefoot, but it's not really advisable. And
Yeah.
probably footwear, like whatever shoes are most comfortable, no, so that you can stand and walk. Yeah.
Yes.
You see,
Although I think it's part of the tradition that they walk barefoot, it's very important that you protect your feet because of someone will step on you or you will step on an object. So
you
really
seen
want to
broken
prevent
toes?
infection. Yeah.
Have you
Uh,
seen those and sprained feet and cut up feet?
yeah. Not cut out, not cut off. Just wounds.
Sorry, I meant cut up, like, all
Uh,
sorts of
cuts.
slashes.
Yeah. Cuts, abrasions, wounds, lacerations, those type of injuries, but not really the very serious ones. Not
Can I ask you, doctor, well, I'll ask you how you prepare for it and like some of the logistical stuff that you have to do and prepare for, that medical emergency personnel have to prepare for. But can I ask you what kind of medicine usually and medical devices or anything do you bring to these events? Because okay, so there's cuts, there's bruising, there's the fainting or the maybe having heat exhaustion or heat stroke. What do you mostly bring to these events as medical emergency personnel so that you can attend to patients and like treat them? Like, do you bring tetanus injections? Oh, you have a cut.
Yeah. Some of them they bring, I mean, tetanus vaccine, but it's not really part of it. So what when we plan for these kinds of events, we really prepare. Okay, there is an orientation. Number one is an orientation from the local government or the organizers, just for the positioning where you position. And then, of course, when you have your position, you know the area that you will be dealing with, and then you will know what types of injuries that you will be dealing with. So you have to prepare all that medications, such as medications for dehydration. We have fluids, IV lines, and then betadine, peroxide to clean the wounds. So any basic, I mean, first aid medications and medications for dizziness, vomiting, headache. So those are the common ones. So, but we are prepared for any type of emergency during these events.
Any type. And then do you also bring apparatus like blood the to take blood pressure or the pulse oximeter to see if the saturation. Okay, so great.
It's very important for us to get the vital signs. So that's the blood pressure. We have the pulse oximeter that can already measure the heart rate and the oxygenation. And then that's it.
You don't bring
the stethoscope.
a
Temperature, not anymore. Only only when necessary, when we have to get the temperature. So it's very difficult to really for this types of events when we don't have the thermometer. Just touching the patient if it's too warm or too hot is enough.
So the Filipino tradition, and I would say culture of, I'm feverish. That's true, right, doctor?
Yes.
I mean, you may not necessarily have a fever, but you can feel there's some heat coming off, or so a lot of people go, and then and then I've lived in a place where, what the hell is that? How can you really tell? I'm like, because we can.
Yes.
Because we're used to that, and yes, we can. I mean, we don't know the exact temperature, but we get an idea. Okay.
Correct.
Doctor, can I ask you, when you go, so you bring everything complete you're ready for any type of emergency. Have you noticed if like at the beginning of the procession, so you have stations every 10 meters, you said, medical emergency stations. Is there a point where the injuries or the incidents of people, having medical emergencies increase, like at the very beginning, or like very near where the procession starts? Is that like less, and then do you assign like, here's the more or
based on experience, when you are stationed very near the church or near the procession, of course you see a lot of injuries there. But where you are in an area wherein you have spectators only, when you have, most of the time when you have spectators, you have elderly patients or patients in the older age. So you'll have medical emergencies here, like headache, dizziness, vomiting, dehydration. So it's really on the location as well. But if you're very near where the action is, it's most of the time it's injuries or trauma.
Doctor, okay. Can we talk about something that's, pretty, like one of the worst case scenarios ever? And I don't know if you've treated people or experienced this, when there's a stampede in a crowd.
Yeah. I haven't had an experience with the stampede. It's very difficult situation where you are in a stampede, and it's really difficult to tell what a person should do. Number one, when you are in a stampede situation, is you should have a presence of mind. You should not be nervous. Okay, you have to think. where should I place myself? Because when you are in a stampede, all the people are pushing or running in one direction. So you have to look where you will exit, where you will look for a safe area where people will not be able to push you or make you fall down. Because when you fall in a stampede situation, that is where very difficult. That's the danger that can happen. So I mean, it's very difficult to be in that situation. I haven't had an experience for a stampede situation. I have heard situation of a stampede, and I've in recently it's just in Korea, correct, where they had a stampede. So I think what I can advise them is just make sure if you are in that situation, be alert and have a presence of mind. And if you cannot uh, uh, run fast in a safe direction, go with the flow. Okay, just make sure to look for the nearest exit. Okay, because you have to move yourself away from the stampede.
And doctor, sometimes you are with people, especially in an event like this. I would imagine that even some people with persons with disabilities would attend, but maybe they won't go so close, because they're
Yeah,
saying you or they're asking for healing. Uh, so, or, sickly people. So you really do have to stay away a little bit. To for safety, because
yes,
it would be so difficult if you get smashed in there and get injured even more. And so basically, doctor, um, what else can you advise for? Oh, okay. What are the protocols for triage? That one when it
oh,
comes to medical emergencies in crowded places. Like, how do you
oh,
treat? Is one fainted?
oh,
Up? How do you? Who do you treat
yeah.
first?
Uh, so the triage system is basically the same thing. When you have patients, you treat the first patient that you receive. But if you have several patients at the same time, yeah, we have a system of uh, it's a scoring system wherein we determine who needs medical attention first. Okay, for those people who have episodes of loss of consciousness, uh, fainting spells, uh, severe headache, severe vomiting. Those are the people that we manage first. Okay, but for those, for example, wounds, minor wounds, we can manage them after we manage those who are in severe need. Okay, so those with alteration in sensorium or behavior, behavioral changes, dizziness, headache, vomiting, loss of consciousness, we manage first.
I mean, it takes, I guess, all your experience, doctor, and your presence of mind to be there, because, like as you said, okay, you have a cut, it's bleeding, but if you apply pressure, we need to take care of this one first to
Yes.
up their guts, because there's could be something more serious going on here. And maybe someone is hyperventilating, but you kind of catch that it's anxiety and someone can attend to them. But there may be someone. Have you seen cases, or are there cases where someone is not as expressive about, they seem to be better than someone else, but you as a doctor can tell that, oh my god, this person is actually probably having a heart attack because they're quiet about it.
Yes, definitely. With experience, you really see those type of patients or person. Some, as you mentioned, this could be a quiet person, not really complaining, but you can see that she's pale, perspiring a lot. The hand is in the chest, clenching. Nag-heart attack na pala. So we see that, and we do recognize these types of patients.
Doctor, is there a certain type of I'm going to say demographic, but for people who end up in such, experiencing medical emergencies, or like an event like this, is it as do you know it's in a certain age, or is it the sex of the person, or the anything, the type of person? Is there something you notice that?
Oh, okay. Uh, when we're talking about the translation, most of the participants here is mostly males. So we see a lot of male patients. So really, part of it is in extreme age as well. So sometimes those really they think they can still join the elderly in their 60s, and sometimes the
Yeah.
families bring their young kids. So those are the usual patients, the
I'm
extreme age.
trying to bring these. Yeah. So yes, I understand that. Okay. So, doctor, okay, do you have any like general advice for people who will attend events like concerts, crowded events? Like concerts, festivals, or religious events. I mean, as we said earlier, it you could be in a smaller. I mean, it could be like there's only 300 of you there, but the place is
Yeah.
smaller. So hot. I actually once almost fainted at mass. And oh, I wanted to ask you this: how come is this medically valid? I also notice when someone's choking. I don't know if it's a Spanish thing, or you they say put your hands up. Does that really help? Or like if you're feeling faint, somebody then like put your hands up.
Is that a choking incident
A choking
or
incident, or like even just feeling dizzy. Like someone say put your hands up, and I was like, I think I'm gonna put my head between my legs. But I remember that time somebody asked me to put my hands up, and I was like, oh, okay, praise God, I might faint. So, but really, but why is that? It's also in our culture to say tas mo yung kamay mo.
I think the gesture of asking someone to put the arms up is just trying to assess or the sensorium or the responsiveness of that person. But in terms of treating a dizziness, it will not do anything about it,
Yeah.
except probably putting a flow of blood going to the brain more. But it's when you are, I mean, having a pain. I mean, when you feel dizzy or you feel that you will faint in an event. When you're standing up, you have to sit down, okay, and then try to lie down, okay, and then uh, place yourself in a position that the blood flow can go to your brain. Okay, you can elevate the legs so that the blood flow can go to your brain. So things that you can do when you have fainting episodes or you feel that you're about to faint. Okay?
Okay. So, doctor, okay. You mentioned how we can prepare. Do you have any more things to say about, well, not only like people who are devotees who attend these events, but I'm sure a lot of our reporters will report on it and
Yeah.
go. And also, I mean, medical personnel and people who volunteer. And I guess, I mean, the priests and the people who are organizing the event, how
Yes.
can they prepare themselves? I mean, it must be also the same, or even if you have a political rally or anything, no?
Uh,
Outdoor. Go ahead, doctor.
okay. Number one is in preparation is plan your activities. So, but when you plan your activity, make sure that you know the event, you know the place, and then you are oriented to the place. So you know where the exit points, the entry points, where the medical teams are located. Number two, you have to prepare yourself. You have to make sure that you are acclimatized or you're conditioned. So if you're a person who's not really athletic or active, try to and the event is about 2 or 3 weeks prior to this one. Try to do walking or exercising prior to going to this event. I mean, you have to make sure that your health is okay when you have to attend this events. Number two, you make sure that during the event you stay hydrated. Okay, drink a lot of water. Bring your water with you. If you can drink in electrolyte solution, sports drinks much better. Okay, and then make sure you plan your clothing and your protective gears. Okay, so you have your coat or caps or anything that will protect you from uh, um, the environment. And of course, you have to have a presence of mind when you're in this, and make sure that you are not a person who is very, gets nervous easily. Okay, so when you're in a situation, you have to think. You have to think well, and you can only do think well when you are in the situation that your body is healthy. Okay.
And as you said, doctor, you even tell your residents you get a good sleep the night before. And
Yes.
don't be, because then, you'll also risk not being in your best condition, even if you're
And,
there.
and I forgot, they also recommend you have a body system. So as someone to, to accompany you. So I think it's important to have a companion when attending events like this. And that's it. I think those are the
That,
things that you have to remember.
that actually reminds me also of someone she told me the story that she was 8 years old and her aunt brought her to see Pope John Paul when he was still he was still alive. Of
Yes.
course. He visited in 1982, was it, or something like that?
Yes.
And her aunt brought her, but then her aunt fainted. So I mean, she was 9, so she kind of
Yes.
freaked out. So yes, the buddy system, you should probably have 2 adults or 2 really able-bodied people there. And yeah, if you bring your kids or your elders, make sure that you don't faint and you can't take care of them. Okay, so
And
is there?
also you have to know how to get help. Okay, the numbers or the medical numbers that you can call or ask for help. Okay, that's the important thing. Okay,
Anything
because
else? I mean, any medical numbers, and then maybe know where the stations are. Anything else, doc?
yes, that's it. Know the event, the plan. Make sure that you are well acquainted with the locations of the exit, entry points, and all the areas where you can rest. Okay, and be prepared. That's it.
Thank you, doctor. Thank you so much. Is there anyone you'd like to say hi to or greet? Are you going to be there this January 9?
Yeah.
Yeah.
Fortunately, I'm not assigned now, but I just want to say good evening if my family is listening in Binoan and Rizal, and all the staff of the emergency department of Makati Medical Center, all the doctors, consultants, residents, nurses, and allied staff, and of course all of the other members of Makati Medical Center. Happy New Year! We're back to work, so it's almost for emergency physicians. We're working any time of the year. So
And
if you need some medical emergencies, Makati Medical Center Emergency Department is there to address your emergency needs.
thank you, doctor, and thank you also to the emergency personnel and other medical professionals who work over the holidays. I mean, it's the medical industry. Really, it's an industry where you can't say I'm taking the holidays off. I mean, you can, but you have to schedule it really
Yeah,
well. And
yeah.
so, thank you to the people who help people during these holidays, and here's to a better new year for everybody, hopefully. And I would love to see you soon, but not in an emergency situation.
Yeah. Nice
Okay.
meeting you again, Miss Nicole, and
Yes,
it's a pleasure uh, talking to you again, sharing the station again with you, so that we can teach our patients or people for regarding medical matters.
yes. Thank you, doctor. It's my pleasure. I really love having you on, and I'm just got lost in the conversation. Thanks so much for being here today, and to everybody out there watching and listening. Thanks for tuning in. We'll see you next week on Healthline with Makati Med. Take care, everybody. Happy New Year.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.